How is the healthcare system responding to the increasing demand for COVID tests, whether it be antigen or RT-PCR? That big question and more with Health Undersecretary Maria Rosario Vergeire. Usec Vergeire, thank you very much for joining us and welcome back to the big story.
Yes, good morning. Good evening, everybody, at magandang gabi at sa inyong pong lahat.
Yes, ma'am. Ma'am, let me start off with this po. What is the policy po? What is the policy with regard to self-testing? Of course, we're not talking about RT-PCR but antigen test. I asked that kasi ang dami ngayon nagsulputan online na nagbebenta ng mga antigen test kits that you can use at home. And some of them appear to have been approved by the FDA. They're in the list of the FDA.
Yes, first I'd just like to inform everybody, wala pa po tayong nare-rehistro ng Food and Drug Administration na self-administered antigen test. Ang meron po ngayon sa merkado ay yung pong existing natin na antigen test na kailangan po ng healthcare professional para maisagawa ito. We need to differentiate between the antigen tests that are existing right now in our market and the self-administered test kits. Yun pong self-administered test kits, pinasimple po iyan na platform kung saan nasal swab lang ang kukunin. Kaya kahit sa bahay, maaari natin gawin. As compared to the existing na antigen test ngayon sa market, you need a nasopharyngeal swab which cannot be done at home by a regular person. Kailangan po healthcare professional ang gagawa niyan.
Ma'am, I ask about that kasi I also saw, personally I also saw dun sa lista ng FDA, a particular antigen test that does not make use of nasal swabs, saliva testing siya. And it was in the list of the FDA. Now, and I also understand your point that in the end, you're also looking at the process, which is that these tests should be conducted by trained medical professionals.
Yes, sir. No, what is in the list, even if it's saliva specimen, is for healthcare professionals. No, it should be guided by healthcare professionals. So kailangan lang po natin ma-differentiate yan. A lot of people are doing this at home and you might be misled by your results because hindi po naging maayos ang proseso natin ng pagkuha ng specimen. So ang atin pong babala lang, there can be misuse of these antigen test kits and there can be misinterpretation of the results which can lead to more issues for us.
Okay, ma'am. Let me shift to another topic. Today, we hit 10,700 new cases. Of course, the number is not really new. We've had worse numbers last year. But I think what strikes a lot of people and what alarms a lot of people is the rate of increase in the last few days compared to last year. What should people bear in mind when they look at these numbers and the numbers that are being projected by both, for example, Okta Research and the UP Pandemic Team?
Yes, sir. No? So pag tinignan po natin the numbers that we are getting, our cases are almost doubling every day. And if this continues, makakaabot po tayo talaga sa matataas na numero in the coming days. So what should be done, yun po dapat ang focus natin. Kung ano ang pwede natin gawin. As soon as you experience symptoms, please isolate. Kung hindi man po kayo makapagpa-test dahil sa haba ng pila sa mga laboratories, what would be most important is for you to isolate yourself para hindi na po makapanghawa sa ating mga kapamilya.
Okay, maraming salamat po, Health Undersecretary Maria Rosario Vergeire. Thank you, ma'am, for joining us tonight.